This movie shows extensive bone loss during tooth extraction. Here we see in the bone view the loss of the buccal bone. The plan is for the tooth to be extracted and for an implant to be placed at the same time as the extraction with possible concurrent grafting. The flap is raised and the tooth is extracted using forceps. During the extraction, we often find the thin bone plate breaking, creating an even more severe defect. There is not enough bone left to place an implant and graft at the same time as planned. To graft this extensive defect, we can use the titanium membrane technique. A titanium membrane is first secured to the outside bone by small screws. Then the defect is filled with bone or bone substitute. The titanium membrane is then fashioned around the defect to secure the graft. If deemed necessary, we can then cover the area with a membrane to further help with the healing. The flap is repositioned and sutured into place. The patient may wear a partial removable denture during the healing phase as a temporary tooth replacement option. The sutures will be removed or resorbed. Underneath the gums, the membrane will prevent soft tissue ingrowth during the healing process. If it is a resorbable membrane, it will eventually resorb. The bone substitute will also be slowly resorbed and completely replaced with the patient's own bone. After sufficient healing time, the flap can be reflected, the titanium membrane removed along with any screws, revealing the new ridge below. Now the bone can be prepared for implant fixture placement. In this situation, a single-stage type of implant placement is demonstrated, in which the healing cap is placed at the same time as the implant. The flap is repositioned and sutured into place. During this healing phase, the patient can still wear their removable partial denture. The sutures will dissolve or be removed, and in 4 to 6 months we can then restore the implant. The healing cap is removed, and the abutment is attached to the implant to give it structure, followed by a crown that will replace the top of the tooth. The gums around this crown may not fit perfectly at first, but will mold to fit in time.